Well, they're combining two bills, one from the Health, Education, Labor, and Pensions and one from the Finance Committee. They'll combine those bills and put them into legislative language and then bring that bill to the floor. I expect that to be about a 2,000-page bill that'll cost around $1 trillion over the next 10 years, and the last year of it about $277 billion. So you can see the range and size of the government takeover, $1 trillion over the 6 years that it's actually active, and about $3 trillion, $2.5 to $3 trillion in the next 10 years. Not at all. We're not involved. That's all Democrat caucus that's doing that. What we'll be involved in is debating the issues of it. Well, I'm disappointed that what we're doing is a one-sided look at healthcare, and the real risk of that is taking what is very, very good about our healthcare system and damaging that as we attempt to fix what's not very good, which is the cost side of it. Well, it's not accurate. We had the first bill out there, which actually saves a ton of money, saves the states about $1 trillion over the first 10 years, and actually drives down the cost of health care and equalizes the tax benefit for health care for everybody. So, you know, that's politics, and it's absolutely untrue, but it makes a good soundbite when, in fact, they voted down our bill 13-10 in committee. Again, just pure politics. It doesn't have anything. She also was very clear to say, I'll vote it out of the committee, but that doesn't mean I'll vote for it when it comes to the floor. You need to ask her that question. And first of all, nobody knows what's in the bill. I mean, the bill came out, Health Committee created 88 new government programs. If you think the federal government isn't going to be involved in your health care with 88 new bureaucracies, you've got another thought coming, because this is a government-centric run at healthcare rather than a patient-centered run at healthcare. And so what we have to do is wait and see, and then we need to outline it for the American people, and they need to get a chance to look at it and see what the actual effect on them is going to be. It is going to, however, impact both the cost of your health care. It's going to drive it up if you have private insurance today. It's going to limit your choices. Ultimately, will limit your choices that you get to make about who your physician is and what kind of care you and your family are going to get. I don't know whether the final package, whenever it finally comes out of conference, will have a public option. But if it is, that's the start to single payer. And they understand that, because a public option plan, if it really works, means that its costs are much lower, so people migrate to it. When the costs are much lower, and the cost to buy it is much lower, but yet the costs are greater, which they will be, you have one of two choices. You either run a deficit with it or you ration the care. Which do you think they're going to do? They're going to do both. They're going to ration the care, and they've already set that mechanism up with this stimulus bill. It's called the Comparative Effectiveness Commission. So what will happen ultimately is you'll move to a public option, which will decrease the number of people with private insurance. Number two, it'll raise the cost of those that are left with private insurance, and ultimately a government bureaucrat will decide what kind of health care you get. Not much, no. I would say no. It would be the better answer to that. Well, I think, you know, they need to find out where their senator stands, and they need to make sure they've communicated that. And then they also need to communicate with all their friends around the country to express what their desire is. You know, there's no question we have problems in healthcare. The biggest problem is it costs too much. It also happens to be the best healthcare in the world. So how do we attack the cost? The bills that are coming aren't going to attack the cost. What they're going to do is transfer the management of healthcare to the government, away from the patient and away from the insurance company. And there's no question it should go away from the insurance company, but it shouldn't go to the government. It should come back to the patient.